Hello dear student. Now let's continue with our anti-Alzheimer agent. In last video we have discussed about the etiology, pathogenesis of this disease. Now let's continue with treatment for Alzheimer disease. There are majorly two types of the drug molecules are used in the treatment of Alzheimer disease. First one is anticholinesterase inhibitor, that is our AChEI inhibitor like tacrine, donepezil, galantamine and rivastigmine. The second one, which is majorly used, is non-competitive N-methyl D-aspartate receptor antagonist, that is NMDA receptor antagonist. Example is mementamine. There is also an adjuvant treatment is given for this Alzheimer disease depending upon the symptom of Alzheimer disease. If a person is having depression, then antidepressant is prescribed. If person is having anxiety, then anxiolytics are given. If person is having some psychic symptoms, then antipsychotics and sometimes anticonvulsants are also given. Now let's discuss the first class of the drug which is used, acetylcholinesterase inhibitors. Acetylcholine is one of the primary neurotransmitter in the neuron, and acetylcholinesterase is one of the enzymes which is responsible for the degradation of this acetylcholine in the synaptic cleft into choline and acetate. That choline is reabsorbed for the formation of acetylcholine. Likewise, the concentration of acetylcholine is decreases in the neurons, which is also leads to the development of Alzheimer disease, and hence acetylcholinesterase, which will going to inhibit this enzyme, we are going to use this drug molecule for the treatment of Alzheimer disease. The mechanism of action of this drug are, they are going to prevent the enzymatic degradation of neurotransmitter acetylcholine by binding with this enzyme and increasing the concentration of acetylcholine in the synaptic cleft and enhance the transmission, which will leads to increased recognition. The drug molecule which is under this category is tacrine. Tacrine is the first acetylcholinesterase inhibitor approved by FDA for the treatment of Alzheimer disease. It is a parasympathomimetic and centrally acting reversible cholinesterase inhibitor. But nowadays it is not used due to its hepatotoxicity. The major side effects which is associated with the use of tacrine is GI symptoms like nausea, diarrhea, cramps. We are going to have altered sleep, bradycardia, muscle cramps. We are going to use this with caution in those who are having an cardiac conduction conditions such as symptomatic bradycardia or those who are having a history of falls. Now, the next drug which is used in Alzheimer is donepezil. Donepezil is also a reversible inhibitor of acetylcholinesterase. It is more lipophilic than tacrine and hence going to have a longer duration of action. It has approximate 70 hours as the elimination half-life and approx 96% protein binding, due to which it is going to have a longer duration of action. Along with that, due to its high hydrophobicity, it is readily crossing the blood-brain barrier and reaching in high concentration in brain for inhibition of acetylcholinesterase. It indicated for the treatment of symptoms of mild to moderate Alzheimer disease. Now, the next drug which is used is rivastigmine. Rivastigmine is irreversible, non-competitive carbamate inhibitor of acetylcholinesterase. It has approximately 2 hours of half-life, but still its effect, that is inhibitory activity of this rivastigmine, will last for 10 hours because it slowly dissociates from an enzyme and hence have a longer inhibitory action. FDA approved it for the use in mild to moderate Alzheimer disease in April 2000, while in June 2007 it is approved to use in Parkinson's disease for the management of mild to moderate dementia. Next drug under acetylcholine esterase inhibitor is galantamine. It is an alkaloid which is extracted from tuberculous plant Leucojum estivum belonging to family Amaryllidaceae. It is an reversible inhibitor which have no effect on butyrylcholine esterase. Butyrylcholine esterase is one of the enzymes which is similar to that of acetylcholine. But galantamine is not used orally because it has an severe GI side effects. Rather than that, it is used in intranasal form, which will have an high drug level more than oral dosing. The next class of drug which is used in Alzheimer disease is NMDA antagonist. The recent evidence shows the involvement of glutaminergic neuronal excitotoxicity in etiology of Alzheimer disease. Hence, the drug which is act by blocking overexcited NMDA receptor is used in Alzheimer disease, which blocks entry of calcium, thereby decreasing the glutamate release and inhibiting procedure, which leads to neurotoxicity. The drug under this category is mementamine, which is a novel NMDA receptor antagonist, which have moderate affinity and which is non-competitive NMDA receptor antagonist with fast blocking and unblocking kinetics. This fast blocking and unblocking kinetic will block the effect of excess glutamate, preserving the physiological activation of NMDA receptor, which will require for learning and memory. The adverse effects of these mementamines are mild and reversible and may include headache and dizziness. This is some comparative table for the drug which is used in Alzheimer disease. The first one is their mechanism of action. Donepezil, rivastigmine and galantamine will act on acetylcholine esterase, while mementamine will act on NMDA receptor. The starting dose for donepezil and mementamine is 5 mg per day, while for rivastigmine we are going to have 1.5 mg at bedtime and 4 mg for galantamine. The usual maximum dose for donepezil is 10 mg, for rivastigmine is 6 mg, for galantamine is 12 mg and for mementamine is 20 mg. These are the some drugs which is going to increases the plasma level of these drug molecules, and hence we have to take precautions when we are going to use this drug along with this anti-Alzheimer agent. So here we cover the drug molecules which are given by FDA, which are approved by FDA for the treatment of Alzheimer disease, and there are some other drugs like anticonvulsant, anxiolytic and antidepressants are also given for the treatment of Alzheimer disease. So, thank you for patient listening.